It's a pleasure to be here. It's a pleasure to help Tim out with this Health Meets Food symposium because right now, food is not meeting health, and that is part of the issue. We always say that food is medicine. What I'm going to try to tell you today is that food can be medicine. It can also be poison. And that's part of the problem, is understanding which foods are which. Part of the reason we don't understand this is the corporate mythology that has grown up around the concept of food that we're going to try to deal with today. And that's why I call this talk Corporate Wealth or Public Health. And you will see that it is the myths that the corporate structure has developed for us over the last 100 years that have sort of landed us in this place that where food all of a sudden does not mean health. So let's go ahead and get started. I am having trouble with my clicker, unfortunately, but let's see. So I do have some disclosures. I did write these books for the general public that Tim just mentioned. The most recent one is Metabolical, which just came out a month ago. And this, if I can, real quick, the standard mantra from the food industry is you are what you eat. What Fat Chance did was it said, you are what you do with what you eat. That actually metabolism is more important than calories. And Metabolical, this new book, actually rephrases that yet again to you are what they did with what you eat. That is, food processing turns out to be the biggest culprit in terms of turning food into poison. So the reason I'm here today is stated on this slide, and it's from a quote of Jeremiah Stamler, who's really the father of cardiovascular epidemiology. If a researcher isn't willing to follow his data into the policy arena, who will? And I did not come at this with an agenda. I basically, the science brung me, as it were, and you dance with the one that brung you. And so I am going to try to basically make the science available for you so that it will be, clear and apparent where things are. So I'm going to divide this talk up into three pieces: the problem, which you already know, but I want to put my spin on it; the three myths of the food industry that have led us here; and finally, the solutions. So let's start with the problem. This paper was published in 2001, and what it looked at was the number of diabetics walking the earth at the time in 2000, which was 151 million. And what it projected was that by 2010, one decade later, we would be up to 221 million. This would be an increase of 46%, or an annualized inflation rate of 3.88%. This is not what we saw. In fact, what we saw was 285 million diabetics for an annualized inflation rate of 6.55%, a doubling over what was originally anticipated. By 2014, we were up to 422 million. That's an annualized percent inflation rate of 10.3%, a tripling in the rate. And more recently, we've learned that, in fact, we are up to 463 million, and what is projected for 2030 is actually up to 563 million. So things are only getting worse, not better, with all of our efforts and with all of our gyms and with gym memberships and with everything that's going on. Things are actually getting worse. Now, people point to the reduction in heart disease death that has occurred over the course of the last 40 years, in part because of improvements in diagnosis and treatment and TPA and various medications, including statins, although we can talk about statins. And so you can see that there is a clear reduction in heart disease. But what has happened instead is that we have traded one disease for another, because diabetes is now rampant everywhere. And there's actually some data to show that these are directly related, that the reduction in heart disease and the increase in diabetes actually go together. Now, if you take a look at the money So in red, you see hospital costs. In green, you see physician costs. And in purple, you see pharma costs. They do not add up to the total costs of taking care of all of the chronic metabolic disease that has developed here in the United States and around the world. So basically, we can't keep up. And that's why healthcare is going bankrupt and why longevity is actually decreasing. There have been 4 years in a row now where our mean lifespan has decreased. And this is the reason, because everyone thinks there's a pill. Well, I'm here to tell you there is no pill. If you take a look at life expectancy against healthcare expenditure, you'll notice that back in the 1970s, all the OECD countries were sort of running together. But we fell off the rails at around 1975 to 1980. And so we are spending more and more and getting less and less in terms of life expectancy compared to all of our European, Asian, oceanic colleagues. And the question is this, pills or public health? What's going on? So I'm here to basically tell you that the reason is because there are 2 inconvenient truths that we have not dealt with. And the first one is there is no medicalized therapy to prevent chronic metabolic disease. There's just long-term treatment, and it turns out the treatment isn't very good. In fact, the treatment sucks. The treatment is not treatment. The treatment is treatment for symptoms, not for disease. So when you give a statin, yes, you lower the LDL, but the LDL is not the problem. The LDL is the symptom of the problem. When you give an antihypertensive for high blood pressure, turns out the high blood pressure is not the problem. It's the symptom of the problem. The endothelial cell dysfunction is still going on. It's like giving an aspirin to a patient with a brain tumor because they have a headache. Might help the headache, ain't going to do a damn thing for the brain tumor. So our long-term treatment is not making any significant inroads in terms of fixing or ameliorating the disease processes that belie these chronic diseases. The second inconvenient truth is you can't fix healthcare until you fix health. You can't fix health until you fix diet. And you can't fix diet until you know what the hell is wrong. And what we've been barking up the wrong tree for the past 50 years. And unfortunately, this has now become mythology. It is now so settled in our American and really worldwide consciousness that it's almost impossible to extricate. Which leads us to the 3 myths. And these are the reasons why we have not been able to advance our health in any meaningful way. And this is inexorably tied up in our culture. The first, it's about obesity. You get fat, you get sick. And obesity, after all, is about energy balance. You eat too much, you exercise too little. So, is it true? Is it about obesity? So on this slide, you see a scattergram of all the countries in the world. Obesity prevalence on the x-axis, diabetes prevalence on the y-axis. And what you'll notice is there is a correlation. And I don't argue that. There is a correlation. And there it is right there. But correlation is not concordance, because it turns out there are countries that are obese without being diabetic, such as Iceland, Mongolia, Micronesia. And there are countries that are diabetic without being obese, such as India, Pakistan, and China. India and China today have a 11% diabetes prevalence. We are the fattest nation on the earth, and we only have a 9.4% diabetes prevalence. If obesity is the cause of diabetes, then how come they have more diabetes than we do? Problem number 1. Problem number 2. Obesity is increasing worldwide at the rate of 2.78% per year over the last 40 years. However, diabetes is increasing worldwide at the rate of 4.07% per year for those same 40 years. If diabetes is just the outward manifestation of the obesity epidemic, how come the diabetes epidemic is going up faster? Problem number 2. Problem number 3. On the left, you can see the increase in total cases of type 2 diabetes in US adults going up, and you can see very clearly that there's been an increase over the last 25 years. But on the right, you can see that those numbers are stratified by weight category: obese, overweight, normal weight. And what you can see is that there's been a 25% increase in prevalence amongst the obese, agreed. But there's also been a 25% increase amongst the normal weight population. If obesity is the driver, how come the obese people and the normal weight people are going up at the same rate? Problem number 3. And there are about 3 other problems with this, which I don't have time to get into, which have to do with some hardcore endocrinology. So obesity is not the problem. People don't die of obesity. Obesity is not even listed on the death certificate. What they die of are the diseases of metabolic syndrome. That's where all the healthcare dollars go. 75% of all healthcare dollars go to these diseases right here: diabetes, hypertension, dyslipidemia, cardiovascular disease, polycystic ovarian disease, non-alcoholic fatty liver disease, cancer, dementia. These are where the money go. And none of these have any cure. None of these even have any treatment. We do have treatment for the symptoms. Sure, we can lower blood glucose. Sure, we can lower blood pressure. Sure, we can lower LDL. But none of these can actually reverse the pathology. So this is the most important set of slides I'm going to show you today. This is a Venn diagram of the entire US adult population, 240 million adults. And you'll notice that 30% of them are obese, that's 72 million. And 70% are normal weight, that's 168 million. So these are 2 mutually exclusive circles. Every adult in America is in one of the 2 circles. All right. Now, the standard mantra from the doctors and the dietitians and the Surgeon General and the Institute of Medicine and the National Institutes of Health and the White House and Congress and the food industry is the following: 80% of those obese individuals, 80% of those 30% of 240 million, those 57 million people there, they're sick. They're fat and they're sick. And they're sick because they're fat. And if they would only just diet and exercise, we could solve this problem. It's all their fault. That's what they say. This is garbage. This is untrue. And it's on the slide as to why it's untrue. It is true that 80% of 30% of 240 million are metabolically ill. I don't argue that. That is true. But that means that 30% of 240 million are not. They are metabolically healthy. We have a name for them. They're called MHO, metabolically healthy obese. They will live a completely normal life, die at a completely normal age, not cost the taxpayer a dime. They even have normal length telomeres, the edges of the chromosomes that unravel, that ultimately determine cell death and then human death. So 20% of the obese population are metabolically healthy. Conversely, turns out 40% of the normal weight population have the exact same diseases as do the obese. Normal weight people get type 2 diabetes, hypertension, lipid problems, cardiovascular disease, cancer, dementia, fatty liver disease, polycystic ovarian disease also. Now they get it at a lower BMI. So there are actually more thin sick people, 67 million, calling the fat sick people at 57 million the problem. And if normal weight people get it too, how can it be about behavior? This actually looks more like exposure. This looks more like tuberculosis or cholera or influenza or COVID-19 for that matter. And when you do the math on the 2 sick populations together, that's more than half the entire US population. And that's what makes this a public health crisis, not a personal responsibility issue. I'll prove it to you. On this slide, we have CT scans through the abdomen of two equally weighted people. Notice trunk fat 12.8, 12.8, right? You can see it there. Okay. One's healthy, one's sick. Which one's sick, A or B? Turns out B. A, he's got big love handles. He's got subcutaneous fat, big butt fat, if you will. Cosmetically undesirable, but metabolically inert. And there are reasons why. That this fat is not the dangerous one. Conversely, down here, you can see this guy's got fat all around his organs here, intra-abdominal fat, what we commonly refer to as the apples and the pears. So this guy would be an apple, this guy would be a pear. Okay, sorry, this guy would be a pear, this guy would be an apple, the other way around. Apologize. In fact, we've actually learned that there's another fat depot that's even more important, liver fat. And we'll talk about that in a minute. In fact, we'll talk about it right now. So the liver turns out to be the most important organ in terms of chronic metabolic disease. On the left, you will see normal liver under a microscope. You'll see the Kupffer cells and the bile canaliculi over here and the normal sinusoids. This is normal liver. And over here, you see not normal liver. You see fat vacuoles here, and you see macrophages moving in here, and you see the start of fibrosis here. This is fatty liver disease. Now, if you throw this under a microscope and ask a pathologist to look at it and say what caused it, but prior to 1980, if they saw that, that would be alcohol. Without question, that would be alcoholic fatty liver disease. But now we have this new disease, which was first diagnosed in 1980, and now encompasses 45% of the US adult population and 20% of the pediatric population, when this has never even been seen before, called non-alcoholic fatty liver disease. And under the microscope, you can't tell the difference between the alcoholic and the non-alcoholic variety. And the question is, what causes the non-alcoholic variety? Turns out that non-alcoholic variety is not specifically just related to obesity. Now, it is true that the percentages, the prevalence is higher in the obese, but take a look at the prevalence in normal weight people, and this is from all around the world. Okay, that's pretty high. So, in fact, fatty liver disease is now the biggest scourge, and it is now the single most common reason for liver transplant in the United States, having overtaken hepatitis C. And you can see here, all right, the BMI is binned here, okay, on the x-axis. And here's the hazard risk ratio for fatty liver. And you'll see in the overweight category, you still see a signal. And even in the normal weight category, it's still occurring. And if you've got diabetes, even higher. And in fact, in Korea, if you have fatty liver disease, you are 3.5 times more likely to develop type 2 diabetes in your lifetime, because the fat in the liver is a cause, a primary cause of metabolic dysfunction throughout the body, including diabetes. So this fatty liver is the sentinel disease. This is the signal that's telling us what's going on. And the fact that kids get it is the canary in the coal mine. So here's the way to think about it. Here's your visual to take home with you. So this is what's known as an MRI fat fraction map. And you'll see this is an obese person. You can see the love handles here, but take a look at this guy's liver, dark, 2.6% liver fat. This is an MHO, metabolically healthy obese. Nothing wrong with this guy. Now take a look at this guy. Notice obesity, of course, but take a look at his liver. 24% liver fat. This is metabolic syndrome. This is what you expect to see. But now take a look at this guy. Notice no obesity, normal amounts of subcutaneous fat, but take a look at his liver, 23%. Thin sick, fat sick, fat healthy. So it turns out it's not the fat you can see, it's the fat you can't. It's not about obesity, because obesity is about the fat you can see. Rather, it's about metabolic dysfunction, which is the fat you can't. And obesity turns out to be a result of that fat, not a cause. So I hope I have dispelled myth number 1 for you. Now let's go on to myth number 2. A calorie is a calorie. This is what everyone says. It's what the entire food industry says. They say a calorie is a calorie, a sugar is a sugar, a carb is a carb, a fat is a fat, a protein is a protein, etc., etc. They even say a fiber is a fiber, and none of those are true. In 2013, Coca-Cola aired a TV commercial, a 2-minute TV commercial on every football telecast in America called Coming Together. And this is a direct quote from that telecast. Beating obesity will take action by all of us based on one simple common sense fact. All calories count, no matter where they come from, including Coca-Cola and everything else with calories. So as far as they're concerned, you can get your calories from carrots, you can get your calories from cheesecake, you can get your calories from Coca-Cola, or you can get your calories from kumquats. Doesn't matter, because if you eat more than you burn, you will gain weight. If you eat less than you burn, you will lose weight. Therefore, it is about energy balance. Therefore, it is about calories in and calories out. Therefore, it is about 2 behaviors, gluttony and sloth. Therefore, if you're fat, it's your fault because you're weak-willed. Therefore, any calorie can be part of a balanced diet. Therefore, don't pick on our calories, go pick on somebody else's calories. All of this comes from this notion that calories are fungible because all calories are the same. And after all, that's common sense. Well, I don't believe in common sense. I believe in science. I believe in data. And the data say something completely different. Because what the data say is that some calories cause disease more than others, because different calories are metabolized differently, particularly in the liver, because a calorie is not a calorie. So, examples, quickly. Almonds. You eat 160 calories in almonds. How many of those calories do you absorb? Turns out 130. What happened to the other 30? Turned out the fiber in the almonds, the soluble and insoluble fiber, formed a gel on the inside of your intestine, actually inhibiting the absorption of those calories early on in the duodenum so that they didn't go directly to your liver. They didn't swamp your liver. They didn't cause the tsunami of substrate that led to the liver having to switch from burning those carbohydrates to turning them into liver fat, called de novo lipogenesis. And so, since you didn't absorb them early, they went further down the intestine where the microbiome, the bacteria, chewed them up. So even though those calories passed your lips and registered as a calorie on your calorie count, you actually never got it. You never saw it because your bacteria chewed it up because it never entered your bloodstream. So a calorie is not a calorie because if it came with fiber, that calorie wasn't for you. It was for your bacteria. But the balance sheet doesn't talk about that. Protein. Turns out, to turn a protein into energy, the liver has to take the amino group off. The process of doing that costs energy. So there's an investment of energy in order to be able to turn a protein into an energy substrate. Now, for carbohydrate, it doesn't have to do that. But for protein, it does. So there's a net loss of energy when you're burning protein for energy instead of carbohydrate for energy. So a calorie is not a calorie because it matters whether it was a carb or a protein as to your net ATP generation afterward. Fat. So we have omega-3s, which are heart healthy, anti-Alzheimer's, save your life. And we also have trans fats, the devil incarnate, consumable poison. They're both 9 calories per gram. One will save your life, one will kill you because the calorie is not a calorie. And finally, of course, fructose and glucose, which is where I've done most of my research. So fructose and glucose are both in sugar, and sugar has gone up like crazy. Our ancestors getting sugar out of the ground, fruits and vegetables and the occasional honey. They consumed about 5 pounds of sugar per year, which is perfectly fine. Here's the growth of the sugar industry in the 19th century, C&H and Domino and Texas, Louisiana, Hawaii, etc. Here's the stabilization prior to World War II when price equaled demand, when we still had sugar in 5-pound bags at the grocery store, hadn't developed supermarkets yet. Here's the rationing of World War II. And here it came back up to the same level. And here's the advent of processed food here in the mid-1960s. And you can see that's when there's been a slow, inexorable climb. And of course, then we had the dietary guidelines for Americans, and we had the substitution of high fructose corn syrup for cane sugar because it was cheaper. And you can see that now we consume 25 times the amount our ancestors did. And the question, of course, is what does that do to you? Well, glucose, the non-sweet molecule in sugar, okay, it's a little sweet. I mean, it's molasses. I mean, do you think molasses is sweet? Yeah, a little bit, not very much. Okay, the majority of glucose entering the liver ends up as glycogen. Very little of it will actually make it down to the mitochondria as pyruvate and participate in the Krebs cycle here, throwing off ATP and carbon dioxide. If you overwhelm your mitochondria with substrate, pyruvate, yes, you will overwhelm the TCA cycle's capabilities. It will throw off the excess as citrate. The citrate will leave the mitochondria through a process called the citrate shuttle. And then that citrate can be acted on by these three enzymes here: ATP citrate lyase, acetyl-CoA carboxylase 1, and fatty acid synthase, to turn citrate into acetyl-CoA, then fatty acyl-CoA, and finally package it with ApoB100 to form VLDL. Very low density lipoproteins, which are your serum triglycerides. And we now know that triglycerides are way more important than LDL in terms of heart disease. Then that VLDL will be exported out of the liver, will circulate in the bloodstream as your serum triglyceride, and take up residence in your fat cell under the influence of insulin. And that is how carbohydrate will make you gain weight. Okay, fair enough. But the majority of the glucose goes to glycogen. Now let's look at some other carbohydrate. Let's look at alcohol. Notice alcohol does not go to glycogen. Alcohol goes straight down to the mitochondria as acetate. The acetate ends up being turned into acetyl-CoA, and the same thing happens. You overwhelm your TCA cycle. Therefore, the citrate gets thrown off, and now you've got a lot of citrate. And so you end up with a lot of VLDL. So you end up with high triglycerides. This is the hypertriglyceridemia of alcoholism. In addition, some of the triglyceride won't make it out, will precipitate as a lipid droplet, and now you have alcoholic fatty liver disease and chronic metabolic disease, because that leads to insulin resistance. Now let's look at fructose, the sweet molecule in sugar, the molecule that is addictive, the molecule that makes you want more. Okay, the glucose doesn't make you want more, the fructose does. You see glycogen anywhere? No glycogen. Fructose comes straight down here to fructose 1-phosphate, ends up as pyruvate, pretty much the whole 100% of it, ends up flooding your mitochondria. Those mitochondria become overwhelmed. The citrate is exported out, and you end up making the triglycerides out of the sugar, out of the fructose. This is the hypertriglyceridemia of sugar consumption. In addition, some of it won't make it out, will precipitate as a lipid droplet. Now you have non-alcoholic fatty liver disease. So as you can see, fructose and alcohol are metabolized virtually identically. And it makes sense that that would be the case, because after all, where do you get alcohol from? Fermentation of fructose is called wine. All right. The big difference between the two is that for alcohol, the yeast did the step getting to acetate. For fructose, we do our own first step, getting to pyruvate. But once it enters the mitochondria doesn't care where it came from. It's the same. And so it causes the same diseases. And that's why children now have fatty liver disease, even though they do not drink alcohol, because they are the same. And you can see you get hepatic insulin resistance, you get hyperglycemia, you get hypertension, all the diseases of metabolic syndrome because of the metabolic pathways involved in fructose consumption. We at UCSF did a very seminal study that we're still publishing papers on. These are 3 of the papers that we published. And basically what we did was we took 43 children in our obesity clinic with metabolic syndrome and fatty liver that are all turning their sugar into triglyceride and exporting it out as VLDL, and they all had high triglycerides. And what we did was we took the sugar out of their diet for 9 days. We did an isocaloric fructose restriction. Now, if you take the sugar out, that's 350 to 400 calories a day gone. Therefore, the patient might lose weight. We didn't want them to lose weight. We wanted them to stay the same weight or even gain weight. So isocaloric, we had to substitute something for the sugar we took out. We gave them extra starch. So in the vernacular, we took the pastries out, we put the bagels in. We took the sweetened yogurt out, we put the baked potato chips in. We took the chicken teriyaki out, we put the turkey hot dogs in. All right, for 10 days. And it turned out liver fat went down 22%. De novo lipogenesis went down 46%. VLDL went down 49%. Visceral fat went down 7%. And most importantly, their pancreas started making insulin properly. So we reversed their risk for diabetes. We reversed their metabolic syndrome just by taking the sugar out of their diet and substituting starch. Can you imagine how much better they would have been if we had just taken the sugar out of the diet and substituted nothing? And this now has been independently corroborated by another group at Emory University and UC San Diego. In fact, do you remember at the very beginning of the talk, I talked about how some food has become poison? Remember, food is medicine, but some food is poison. Well, this is the poison. So Ron Kahn, who is the CEO of Joslin Diabetes Center, published this paper in 2019 showing that glucose actually increases mitochondrial beta oxidation by activating both AMP kinase and activating this guy over here, okay, hydroxyacyl-CoA dehydrogenase. So that's good. But fructose inhibits this enzyme over here called ACAD-L, acyl-CoA dehydrogenase long chain, and actually decreases beta oxidation. We also know that fructose inhibits AMP kinase, and that also, because of the uric acid formation, inhibits carnitine palmitoyl transferase 1A, which is over here, which is what is the shuttle, the chaperone, that gets the fatty acids into the mitochondria in the first place. So the more sugar you eat, the less well your mitochondria burn. Can you name another compound that causes your mitochondria to shut down? How about cyanide? Okay, now fructose isn't quite as severe as cyanide, but anything that reduces mitochondrial beta oxidation is a poison. Sugar is a poison. Therefore, ultra-processed food, which has all this sugar in it, is a poison. It is not food, it is a poison. But we're told food is medicine. Well, not all food is medicine. So we now have the data to say causatively, proof positive, that sugar causes 4 diseases. Causes: diabetes, heart disease, fatty liver disease, and tooth decay. We have indirect data for correlation between sugar and cancer, sugar and dementia. We're working on those. We're not there yet. But I think 4 is pretty good. American Heart Association knows this, and I was part of this panel, and we recommended reduction in sugar intake from 22 teaspoons down to 9 teaspoons per day for males, 6 teaspoons per day for females. The problem is that is a reduction by 67 to 75%, and we haven't done anything near that. We've reduced our sugar consumption by about 10%. So we are still triple over our limit. So a calorie is not a calorie, because if that calorie happens to poison your mitochondria, it ain't a calorie, it's a poison. Myth number 3, again, fomented by the food industry. It's about personal responsibility. Now, the question is, where did personal responsibility come from? Is it in the Constitution? Is it in the Declaration of Independence? Is it in the Magna Carta? Is it in any document anywhere? In fact, personal responsibility is not a God-given right. Personal responsibility is an ideology. Okay. And where did that ideology come from? Well, it turns out it came from the tobacco industry in 1962, because they were getting killed on the science and they had to invent another reason for you to smoke. No one put that cigarette in your mouth. No one lit it for you. Personal responsibility. Hey, suffer the consequences. Take the risks, suffer the consequences. Very American, very libertarian, but completely divorced from any sort of meaningful uh, uh, democratic initiative. Okay, purely an ideology. Now, in order for you to invoke personal responsibility, you need 4 caveats to be present as well. The first one is knowledge. You have to know what you're doing. Well, it turns out there are actually 262 names for sugar, only 56 on this chart. But in fact, if you go to hypoglycemia.org/added sugar repository, you will find the 262 names for sugar. And the food industry uses all of them. And you are kept from knowing how much sugar is in foods because the added sugar is not on the label. And also the percent daily value is not included. You'll notice there's a percent daily value here in purple for every other item on the food label except for sugar. You need access. So if you don't have access, how can you exercise personal responsibility? You need affordability. That is, you have to be able to afford your choice, and society has to be able to afford your choice. And right now, we can't afford that choice because we're going bankrupt. And finally, your choice can't hurt anyone else. Because if your choice hurts someone else, that's called anarchy. And that's what we have right now. This is called externalities. Now, for tobacco, we had externalities called secondhand smoke. For alcohol, we had externalities called drunk driving and car deaths. So the question is, what's the externality for your sugar consumption? And the answer is the loss of healthcare. Okay, healthcare going down the tubes. That's the loss. Okay, and that's why you pay. Your employer pays $2,750 for obesity-related healthcare, whether you're obese or not. That's coming out of your wallet. So yes, your sugar consumption affects me. In 2013, this paper came out in The Lancet, and it was called Profits and Pandemics. And what it said was that when I went to medical school back in 1976, I learned the old medicine, and the old medicine was about infections, and the vector was microbes. Today, doctors have to learn the new medicine, and that is about chronic disease, and the vector is multinational corporations. And just like microbes, multinational corporations under threat learn resistance. And that's where the solutions come in. So let me just take this slide I showed you before with the processed food here at 1965, okay? And what I'm going to do now is I'm going to overlay on this slide the percent of GDP spent on healthcare in the United States for the same period of time. What do you see? When processed food became our major diet staple, that's when healthcare costs started to rise out of control. And the reason is because ultra-processed food is not food. Ultra-processed food is poison. In fact, it is affecting not just healthcare dollars, not just dollars going out, but it's affecting dollars coming in. So this was done by Morgan Stanley in 2015, looking at economic growth here on the y-axis against time, and saying that if we adopted a low sugar model, that is, adhering to the USDA guidelines, we could actually stabilize our economic growth at about 2.3%. But in a high sugar model, which is what we currently have, we will reach a 0.0% economic growth by the year 2035. Now, who is that good for? So this is affecting you. This is affecting everyone, whether you eat sugar or not. That's why this is a public health crisis. Remember this slide from the beginning? So here's where ultra-processed food came in, and here's when we went off the rails. And the reason is because we're trying to fix a poisoning, and we don't have an antidote. And the problem is, and this is the important part, the food industry knows, and they've known forever. They've always known. And this is proof that they knew, because this is work that my colleagues at UCSF, Kristen Carnes, Laura Schmidt, and Stan Glantz did, published in 2016. They found the paper trail from the sugar industry, which showed that they commissioned two Harvard School of Public Health scientists, Fred Stair, the chair of the Department of Nutrition, and Mark Hegstead, his assistant, who went on to become the head of the USDA in 1970, to publish two papers in the New England Journal of Medicine, sponsored by the Sugar Research Foundation, except that the Sugar Research Foundation's funding and role was not disclosed. And the goal of these two papers was to single out fat and cholesterol as the dietary cause of heart disease and downplay the evidence that sucrose consumption was also a risk factor. They knew. They knew then, they know now. In fact, it went on, and the sugar industry influenced the NIH, okay, to stop researching the role of sugar in dental caries, and got the NIDR, the National Institute of Dental Research, to focus its influence on finding a dental caries vaccine. Okay, and other studies where they knew that sucrose was linked to hyperlipidemia and cancer, and this was deep sixed. And most recently, and this is just a week ago, notice May 31st, leaked documents at Nestle, okay, which made it into the Financial Times, show that they know that 60% of their products do not meet recognized definitions of health. So the industry culture has not changed in the last 50 years. They continue to push the poison, saying it's food and food is medicine. No wonder we can't fix this problem, which now leads me to the solutions. The good news is that the public is waking up. That is the good news. And we actually have data to show that the public is waking up. This is from IFIC, the International Food Information Council, a industry trade group. And they do a food and health survey each year, and they ask questions. And this was what they published in 2018. They said, Dr. Robert Lustig's mantra that not all calories are created equal appears to be resonating with more US consumers, with 1/3 of Americans believing that sugars are the source of calories most likely to cause weight gain, compared with just 11% 7 years earlier. So here is that survey, and here's the data. What source of calories most likely to cause weight gain? Here's 2011, 2018. And what you'll notice is the people who said sugars went from 11 to 33%. The people who said refined carbs went from 9 to 25%. The people who said they were all the same or don't know went down by the exact same amount. So we are changing people's minds. These people now have been changed from all calories are the same to, in fact, processed food is the problem. More people now know a calorie is not a calorie, and that processed food is the problem. Yesterday, you actually heard from Dr. Nessel that calories are the same. I am here to tell you that calories are not the same. Okay, and this is where Dr. Nessel and I differ. In fact, I'm not the only one who says this. In fact, the food industry is getting on board. In fact, Mars, the candy maker, came out in favor of an upper limit for sugar consumption. And they supported the Dietary Guidelines Advisory's recommendation back in 2015 that no more than 10% of daily energy intake be added sugar. And even Coke has come out supporting the WHO's sugar guidelines because they're under fire because of the Global Health Energy Balance Network that got caught with their you-know-what in the ringer back in 2015 due to Anad O'Connor in the New York Times investigative reporting showing that they had paid off scientists. So the subterfuge continues. Whether it's Coke, whether it's Nestle, doesn't matter. Now, the problem is they're slowly responding. Here's about Pepsi. The government asked, this is the Indian government, asked Pepsi to cut its sugar content. So Indra Nooyi was the CEO of Pepsi, and she was trying to get the calories down in Pepsi Cola. And the Indian government came to her and said, we have a diabetes pandemic of 11%, and we need you to reformulate Pepsi Cola for the Indian population. The problem is when they did that, Pepsi also lost $349 million, and Wall Street called for Indra Nooyi's head on a spear because she, quote, took her eye off the ball. And so this never happened. Credit Suisse, an international global investment bank, said in 2013 in this report, we believe higher taxation on sugary food and drinks would be the best option to reduce sugar intake and help fund the fast-growing healthcare costs associated with type 2 diabetes and obesity. A global investment bank is calling for taxation. I mean, think about how nutty that is. But that's how bad this is. And the reason is because this is a poison with no antidote. The only thing you can do is avoid the poison. The International Diabetes Federation went to the G20 and said, tax sugar to save lives and money. So the doctors know, but unfortunately, the food industry continues to obfuscate and governments continue to be paid off. Now, having said that, some countries have adopted a sugar tax. In fact, 28 countries have adopted a sugar tax, including the UK. The WHO supports it. And here are the 28 countries around the world that now have sugar taxes. We in America, there are 6 cities that have a sugar tax, San Francisco being one of them, because of our work at UCSF. So my questions to you: can our toxic food environment be changed without governmental or societal intervention? We have to get rid of these myths. But particularly when there are potentially addictive substances involved where people don't want to lose their fix. Question number 2, can we afford to wait to enact public health measures when healthcare will be bankrupt due to chronic metabolic disease, which is already occurring? And Medicare will be bankrupt by the year 2029. And lastly, can 6-month-old obese babies change the medical profession or the food industry or Washington? Because we now have an epidemic of obese 6-month-olds. We actually have an epidemic of obese newborns because sugar crosses the placenta and is actually generating increased fat in newborns, in fetuses before they're even born. So we have to advance the public health, and that's why health meets food is so important. That is what we are doing right now. We need public education about what real food is versus what processed food is. We need businesses to understand and actually help us move this forward. We need government agency action, and ultimately we need legal recourse. Now that legal recourse is actually happening, and if you're at all interested, you can email me and I can tell you what steps are being taken. So in conclusion, this is a public health crisis because it's an exposure. It's not a behavior. Even in normal weight people, processed food is the exposure. It is the poison. The food industry has adulterated our food supply for its own profit. The industry has bought off scientists and co-opted critics in the process. Most of the checks and balances have been eroded, and government has been complacent and in some cases even complicit. Our best chances, our best chances are public education, business, and legal action. And we are working on all of those, and we are doing our best, but it is a long slog, especially when the entire country and really the entire world is addicted. So with that, 5 proposals, things to think about. At UCSF, we have launched the Healthy Beverage Initiative. If you come onto campus at UCSF, you can't buy a sugared soda. And in fact, we studied it when it went into effect in 2015. And you can see that we cut sugared beverage consumption in half in our employees. And their waist circumference went down by 2 centimeters, and their insulin sensitivity improved by 25%, just by getting it out of the vending machines at UCSF. All hospitals should get rid of their sugared beverages. We have to role model for society. Where were cigarettes first banned? Hospitals. Okay, it is our job. And I'm sure Mr. Voss will be talking about this following me. Proposal number 2, let's rename type 2 diabetes. Let's call it what it is, processed food disease. Oh, you've got processed food disease. You think that would make a big difference in terms of how people thought about their disease process? Proposal number 3, roll back the subsidies for processed food, corn, wheat, soy, and sugar, because these are the things that are killing us. Proposal number 4, our nonprofit called Eat Real. Okay, if this is fresh fruit, then we got a problem. But right now, this falls under that category. Pizza is a vegetable, as you know, because of the tomato sauce. I mean, really? There's more sugar in the tomato sauce than there is tomatoes. And finally, proposal number 5, let's get fructose off the generally recognized as safe list. And this is currently under consideration by Center for Science and the Public Interest. Obviously, this will be a long slog. The food industry will put up every road barrier you can possibly imagine. But this is what needs to happen, because when it comes off the GRAS list, then fructose becomes a food additive rather than a food. And then we can put limits on what the food industry can do. So for public resources, sugarscience.org. Okay, this is curated by UCSF, 8,000 clinical research articles vetted by 12 independent scientists who don't take money. I'm one of them. Office infographics. You can find them at robertlustig.com. You can hang these in your office. This is a poster we made with metabolic syndrome signaling, putting the liver at the center of everything that's happening. Fed Up, a documentary that tells how we got to where we are today. Sugar Coated, a documentary that tells us why we got to where we are today. That is the corporate payoffs and the industry subterfuge. Sweet Revenge, a PBS special on how to reverse your diabetes by eating real food. And with that, I'll close, and I look forward to the panel discussion later.